Thank you. Thank you, Dr. Barbosa, for your kind invitation. Um, Thank you all for coming on this Saturday morning. I really appreciate. It really shows a lot of dedication that everyone came out to want to further their education and learn, especially a topic that is really the forefront of dentistry right now. I also want to thank Hayasin for inviting me and being supportive. I've been working with Hayasin for the past 3 years, lecturing and using their implant, and only have great things to say. So a lot of the cases that you see here today that we're going to be showing are Hayasin implants. So a little bit about myself. I went to UCLA Dental School, USC for perio, and I want to introduce the prosthodontist that I work with, Dr. Suar Gabi. He went to Tufts Dental School, Columbia AEGD, and USC Prosthodontics. If you want to please come up over here, we're going to be presenting this together. And the mere symbolism of him coming up here, it shows a lot of what it takes to do these cases. It really, the surgery is an art, and the prosthodontics, the restoration is an art. And we're going to show you, to get a good result, what exactly and how in detail these cases can be. And what you guys are going to be seeing is basically the tough cases. This is the hardest area. Anyone in this room can place an implant on number 14, 12 area, slam dunk. Got enough bone, can place it. It's just like putting a screw into the wood. But in the front, it's a little bit different. There's a lot of different other considerations. So let's get into that. Our topic is immediate implant placement in the aesthetic zone. This is an area of actually both of our focuses in our training and in our practice. So we will be talking, introducing the topic, going through the paradigms, indications and limitations, case presentation. So as far as the introduction, going back to Brennemark, he basically said that once you place an implant, you need to wait about 6 to 8 months. It takes about 3 to 6 months for it to integrate, and provisional phase takes another 9 to 14 months. But a very high success rate he showed. But why is that not being as popular? Why don't we have to wait as long? Because when you take out a tooth and you wait, you're going to lose a lot of bone. There's longer treatment time, increased time of edentulosum, which means you need more time for the patient to have the restoration, the provisional phase. So if you have a patient who's wearing a denture for over a year and they don't even like to take anything in and out, they're going to be very frustrated. So this procedure will speed things up because, these days patients want things yesterday. They don't want to wait anytime. And of course, you have additional surgical procedure. Each time you do a surgery, they have to pay for parking. They have to wait in the waiting room, numb up, antibiotics afterwards. So it's extra stress for the patient. And that leads to the psychological impact on the patient. When you take out a tooth, at any point, you're always going to lose bone height and bone width. On average, the studies show about 4 millimeters of ridge height and 25% of the loss of total bone that happens in the first year. Volume of bone loss increases throughout the 3 years after about 40 to 60%. Also, 2 studies that were showing in the placement in the 70s that, as far as categorizing, that with immediate now we're talking about immediate, now we can do it quickly. You can take the tooth out and put the implant immediately. Waiting, again, 3 to 6 months, provisional phase. Now, remember, sometimes provisional phase, you don't have to wait at all. You could provisionalize right away, and we'll get into that. So immediately following tooth extraction, that's the class 1. Class 2 is waiting for the tissue to cover. So what does that mean? It means you take out the implant. One option is putting in the implant right away. Another option is taking out a tooth, When you take out a tooth, you have a hole. Waiting about, I would say 2 to 6 weeks even, for the soft tissue to cover. You get the epithelial lining, you get primary closure at that point, and then come back and place the implant. Why is that a good option? Because if the patient smokes, you can come and place the implant, you have primary closure. You don't get bacteria leaking. You don't have any gaps. So a lot of times you hear about immediate. This is also a really good option. It's called delayed placement. So you just wait for the tissue to close, you come back, and you still have a hole. Class 3 is basically waiting for that bone to fill in. That's the traditional take out a tooth, wait 4 months, and place the implant. And then anything greater than that is a patient who said, I got this tooth taken out 2 years ago or 3 years ago. Now I have the money, I want to do something about it. So as far as classification, you can see we're saving an extra appointment and a surgery. Okay. As far as both of them are going to be pretty challenging because you don't have all the bone that you need for both immediate and early. Delayed, which means waiting, usually you have the bone. Bone sets the tone. It's all about the bone. If you don't have the bone, you can't place the implant. Now, how much bone do you need? Where do you need the bone? Do you need the bone on the buccal? In a proximal. Where is that bone important? And we'll get into that. The most important place is the buccal.